all yours.
Great. Thank you, Daryl. That was a wonderful introduction. Can you please go to the next slide?
It'll advance in a second.
Well, that's okay. I can start talking before the slides there. My name is Dana Barnett. I am the program coordinator for the state of Alaska's Medicare Information Office. I want to start today's webinar by explaining a little bit about my office, who we are, what we do, and why we do it. So who are we? We are Alaskans helping Alaskans get more out of their Medicare by providing one-on-one Medicare counseling to beneficiaries, their caregivers, and families. We improve lives and save customers money by helping with when and how to enroll into Medicare, billing questions and errors, choosing a prescription drug plan, explaining the coordination of benefits with retiree and employer coverage. Our Medicare counselors also screen folks with limited income and resources for programs which may help them with their Medicare costs. Much like today's event, we do group outreach and education events for Medicare beneficiaries, employers, partner agencies, tribal outreach and enrollment specialists to help navigate the Medicare maze. All presentations include information on how to identify and report Medicare fraud, waste, errors, and abuse. Medicare beneficiaries are in the unique position to find and report fraud with Medicare. Next slide, please. So although the Medicare Information Office is a state office, the administration for community living is responsible for the 3 federal grants that fund our efforts. First, we have our State Health Insurance Program, or SHIP grant. The mission of the SHIP program is to provide free, local, one-on-one, and sometimes face-to-face Medicare and health insurance counseling to Medicare beneficiaries. The program also offers community outreach and group education to the public about Medicare insurance. The Senior Medicare Patrol, or SMP program, recruits, trains, and supports retired professionals to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse through outreach, counseling, and education. And then we have our Medicare Improvement for Patients and Providers Act, or MIPA. Our MIPA grant provides funding to conduct outreach and enrollment for limited income Medicare beneficiaries into the Part D Low Income Subsidy, or Extra Help, and the Medicare Savings Program, or MSP, and to promote utilization of Medicare's preventative services. Every state and U.S. territory has a SHIP, SMP, and MIPA program, but depending on the state, it can be called SHIBA, SHINE, or here in Alaska, the Medicare Information Office. Next slide, please. The Medicare Information Office is a small office of 4. There's myself, I oversee the office, counsel individuals on Medicare, provide group outreach and education, manage the federal grants which fund the MIO. Janae Larson, who will also be presenting with me today, has been with our office for 15 years and is our lead Medicare counselor and subject matter expert. Much like myself, she does one-on-one Medicare counseling, group outreach and education, and Medicare dissemination throughout Alaska. Heather Anderson is our front desk office assistant too. Heather answers the busy 1-800 number for the state of Alaska, triaging calls, scheduling appointments, ordering office supplies, and really any other duties to keep the MIO running as efficiently as possible. So if you call our main line, you'll most likely speak to Heather. Colton Percy is our new volunteer coordinator. His focus is recruiting, training, and retaining volunteers from all over Alaska. Our volunteer program is a requirement of our federal grants, and helps the MIO meet the growing demand of Medicare beneficiary population in Alaska. Next slide, please. The Medicare Information Office currently has 79 volunteers in our program. Some are what we call in-time volunteers, meaning with their job, they have a need to know and understand Medicare. We also have what we call true volunteers. These volunteers, out of the goodness of their heart, volunteer their time and energy to the MIO program. We have many different volunteer roles available, helping with administrative duties, to disseminating information, doing one-on-one Medicare counseling, providing Medicare education presentations, and of course, working on complex interactions. Because so much time is devoted to educating our volunteers, we do request a one-year dedication to our program. We are currently recruiting volunteers from all over Alaska. The Kenai Peninsula and Southeastern Alaska are some of our biggest need of volunteers. Qualities we're looking for is good oral communication, active listening skills, ability to complete the counselor training and certification, and of course, willingness to learn and share information to healthcare benefits through the understanding of Medicare coverage, and ability to explain that in terms that beneficiaries understand. The MIO has also partnered with agencies who can help us get accurate and authoritative Medicare information. AARP Alaska partners with us to conduct workshops all over Alaska about the ABCs of Medicare, preventative services, limited income program, and how to detect and report Medicare fraud and abuse. This partnership has helped us reach more beneficiaries both in person and virtually around Alaska. By working with our volunteers and our partners, we have a much larger reach. So if you or someone you know is interested in learning more about our program, please check out our website at www.medicare.alaska.gov, and it's on that slide. And you can always click on our volunteer tab, or you can call our volunteer coordinator, Colton Percy, directly. Now that you know a little bit more about the Medicare Information Office and the vested interest we have in helping individuals understand Medicare, I'm going to turn it over to our favorite Medicare guru, Ms. Janae Larson, to cover the Medicare A, B, important enrollment periods, costs, and Medigap. Take it away, Janae.
Thank you so much, Dana. Good day, everyone. Daryl, you can go ahead and advance the slide.
Okay, and Janae, since we're about to get into the substantive part of the presentation, if people have questions, can we just recommend that people hold their questions to the end and then raise their virtual hand when we get to the end and have the time available for the Q&A session? Does that sound good to you, Janae?
I think that would be best. We may end up answering your question as we move through the material, so we will hold questions till the end, please.
Thanks so much.
Thanks, Daryl. Medicare currently provides health insurance for 62 million people in the United States who are 65 and older, under 65 with certain disabilities who have been entitled to Social Security Disability Insurance, also called SSDI benefits, for 24 months, which includes ALS, amyotrophic lateral sclerosis, also known as Lou Gehrig's disease, without the 24-month waiting period normally applied to SSDI benefits, and those of any age who have end-stage renal disease. This is also called ESRD, which is a permanent kidney failure requiring regular dialysis or kidney transplant. The Medicare and You Handbook is pictured on this slide. It's mailed to every Medicare beneficiary who's new to Medicare and to every Medicare household each year in the fall. You can also access this booklet electronically at the federal website, medicare.gov. It explains Medicare and provides information on Medicare health and drug plans in your geographic area. Go ahead with the next slide. There are two main federal agencies responsible for Medicare. Social Security is responsible for enrolling most people in Medicare. Social Security also maintains your personal information, such as your name, address, date of birth, and then sends these details to Medicare's records. If any of your personal information needs to be changed or updated, you can visit or create an online My Social Security account or call Social Security. Medicare coverage and benefits are administered by the Centers for Medicare and Medicaid Services, also called CMS. To get coverage and benefit information, you can create a personalized Medicare account, get general information online at medicare.gov, or by calling 1-800-MEDICARE. Next slide. If you are already getting Social Security benefits, you will automatically be enrolled in Part A, hospital insurance, and Part B, as in Bravo, medical insurance. You will get your Welcome to Medicare package, which includes your Medicare card and other information, about 3 months before you turn 65. Coverage begins the first day of the month you turn 65. There is an exception if your birthday is on the first day of the month. Your coverage begins on the first day of the month before your 65th birthday month. If you are under 65 and have a disability, you will automatically get Part A and Part B, as in Bravo, after you get disability benefits, SSDI, from Social Security for 24 months. You will get your Welcome to Medicare package about 3 months before your 25th month of disability benefits, and your coverage begins on the first day of the 25th month of disability benefits. The Welcome to Medicare booklet and Medicare card sent in your Welcome to Medicare package are pictured on this slide. Next page. If you are not getting Social Security benefits at least 4 months before you turn 65 and you want to sign up for Medicare, you need to apply with Social Security. You don't have to be getting Social Security benefits to get Medicare. You can enroll online at the socialsecurity.gov website or call the national or local field offices for a telephone appointment. After Social Security completes your Medicare application, you should expect to receive a Welcome to Medicare package in the mail, which includes your Welcome to Medicare booklet and your Medicare card. Next slide. Your first opportunity to enroll in Medicare is during your initial enrollment period, also called the IEP, which is a 7-month period that begins the full 3 months before the month you turn 65, continues through your birthday month, and the full 3 months after your birthday month. Your coverage starts based on when you enroll. If you enroll in any of the 3 months before your birthday month, your coverage will begin the first day of the month you turn 65. Remember the exception. If your birthday is on the first of the month, coverage begins the first day of the month before your birthday month. If you enroll in the month you turn 65, your coverage will begin the first day of the month after your birthday month. If you enroll in the last 3 months of your initial enrollment period, the 3 months after your birthday month, your coverage will be delayed 2 to 3 months. If you don't enroll in Medicare timely, you may pay a late enrollment penalty. I will talk more about the penalties later in the presentation. It is important to understand Medicare enrollment periods and how other insurance you have works with Medicare, so that you can make wise enrollment decisions and have coverage in place when you need it. Next slide, please. There is an exception to your initial enrollment period. If you or your spouse is still working and have a group health plan through that current active employment, you may choose to delay Medicare Part A and or Part B, as in Bravo, during your initial enrollment period. A special enrollment period, or SEP, allows you to enroll later and not face late enrollment penalties. If you qualify for a special enrollment period, you can sign up for Part A and or Part B anytime you are still covered by the group health plan, or during the 8-month period that begins the month after the employment ends or the group health plan ends, whichever happens first. If you do not enroll in Medicare within the 8-month special enrollment period, you will have to wait until the general enrollment period to sign up. You will have a gap in your coverage, and you may have to pay a late penalty. It is important to understand, to qualify for the special enrollment period, your group health plan must be based on your or your spouse's current active employment. It is important to note, COBRA, retirement coverage, Veterans Affairs, and Indian Health Service are not considered to be from active employment and would not qualify you for the special enrollment period. Next slide, please. If you didn't sign up for Medicare during your initial enrollment period and you don't qualify for a special enrollment period, you can enroll during the general enrollment period, or GEP. The general enrollment period is happening right now. It starts each year on January 1st and ends March 31st. If you enroll during the general enrollment period, your coverage will start on July 1st. This is required by law. In addition, if more than 12 months have passed since you were eligible for Part B or Part A, if you have to buy it, you will pay a 10% surcharge for each full 12-month period you were eligible but not enrolled. That surcharge is added to your monthly premium. The longer you go without coverage, the higher the penalty. I will better define the late enrollment penalties in a moment when reviewing Medicare costs. Next slide. Now let's talk about coverage. Part A, hospital insurance, helps cover medically necessary inpatient services, such as inpatient hospital care, skilled nursing facility care, also called SNF care, hospice care, and home health care. Next slide. Part B, medical insurance, helps cover medically necessary doctor services, outpatient medical services and supplies, laboratory, durable medical equipment, which you may hear us refer to as DME, diabetic testing equipment and supplies to check your glucose, preventive services, home health services. You'll notice home health can be used under both Part A and Part B, depending upon the circumstances. Outpatient physical therapy, occupational therapy, and speech language pathology, and outpatient mental health care, To find out what Medicare covers, if there's not a service on this list, you can always review your Medicare and You Handbook. Remember, that comes to you each year in the mail in the fall. You can also visit medicare.gov or call 1-800-MEDICARE. You can also download a free What's Covered mobile app, which is available on both the App Store and Google Play. Next slide. You don't pay a monthly premium for Part A coverage if you or your spouse paid enough Medicare taxes while working. This is called premium-free Part A. Federal Insurance Contributions Act, or FICA tax, is the U.S. federal tax that funds Social Security and Medicare. About 99% of people with Medicare don't pay a Part A premium, since they've earned 40 credits or worked at least 10 years paying those Medicare FICA taxes. If you're not eligible for premium-free Part A, you can buy it. In most cases, if you choose to buy Part A, you must also have Part B and pay monthly premiums for both. The amount of the Part A premium depends on how long you or your spouse worked and paid Medicare taxes. Social Security determines if you must pay a monthly premium for Part A. In 2001, the Part A premium for a person who has earned less than 30 credits is $471 per month. Those who have between 30 and 39 credits may buy Part A at a reduced monthly premium of $259. If you aren't eligible for premium-free Part A and you don't buy it when first eligible, your monthly premium may go up 10% for every full 12-month period you didn't have the coverage. You'll have to pay the higher premium for twice the number of years you could have bought Part A but didn't. When you received medically necessary inpatient services covered under Part A, you must first pay the Part A inpatient hospital deductible for each benefit period. There's no limit on the number of benefit periods you can have. In 2021, the Part A deductible is $1,484 per benefit period. So a benefit period refers to the way Medicare measures your use of hospital and skilled nursing facility care. A benefit period begins the day you're admitted as an inpatient in a hospital or skilled nursing facility. The benefit period ends when you haven't gotten any Medicare covered inpatient care for 60 days in a row. Next slide, please. Medicare costs are updated each year. In 2021, for a hospital inpatient stay, after you pay the deductible amount of $1,484, you pay no coinsurance for days 1 through 60. There is a $371 coinsurance per day for days 61 through 90, and a $742 coinsurance per lifetime reserve days. This means after a 90-day inpatient stay, Medicare will only cover 60 more days in the hospital. These are known as your lifetime reserve days. You may use them all at once or at the end of many 90-day stays. After your lifetime reserve days are used up, you are responsible for all costs for any hospital stay longer than 90 days. For skilled nursing facility care, you pay $0 for the first 20 days of each 60-day benefit period. Then $185.50 coinsurance per day for days 21 through 100, and all costs after day 100. Next slide, please. Everyone pays a Medicare Part B medical premium. The monthly Part B premium will be deducted from Social Security automatically when your coverage starts. If you don't get Social Security benefits, you will be directly billed by mail for your Part B premium, usually every 3 months. The monthly Part B premium is $148.50 in 2021. If your modified adjusted gross income is above a certain amount, you may pay an income-related monthly adjustment amount, also called IRMA. The Part B premiums for people with higher income are shown on the next slide. Remember, this premium may also be higher if you don't choose Part B during your initial enrollment period when you first become eligible and you don't qualify for a special enrollment period. The cost of Part B may go up 10% for each 12-month period you could have had Part B but didn't take it. Usually, you must pay the late enrollment penalty for as long as you have Part B. Next slide, please. Most people will pay the standard premium amount. If your modified adjusted gross income is above a certain amount, you may pay an income-related monthly adjustment amount. Roughly 5% of people with Medicare pay an income-related monthly adjustment amount. The total Part B premiums for people with higher income are shown on this slide based on your tax filing status. When you sign up for Medicare Part B, the Social Security Administration will automatically request your most recently filed income tax return, which is usually the return from 2 years ago. You should expect to receive a letter from Social Security regarding your Medicare premium amount each year. If you must pay a higher amount for your Part B premium and you disagree, for example, if your income goes down, the letter from Social Security will explain how to request a new determination on your premium. Social Security will automatically redetermine your Medicare premiums each year by requesting your new income tax return. Next slide, please. We just reviewed the 2021 deductible and coinsurance costs for Part A and B. Since Medicare doesn't cover 100% of your medical costs, you may want to add on supplemental insurance coverage. A Medicare supplement insurance policy, also called Medigap, is health insurance sold by private insurance companies to fill gaps in original Medicare Part A and Part B coverage. Medigap policies can help pay your share of the costs for Medicare covered services. Medigap policies must be one of the standardized plans, A, B, C, D, F, G, K, L, M, and N. This is so they can be easily compared. Each plan has a set of benefits that are the same for any insurance company. It's important to compare Medigap policies because the costs can vary. Each company decides which Medigap policies it will sell and the price for each plan. The state of Alaska Division of Insurance reviews, approves, and regulates these Medigap companies in Alaska. Next slide. All Medigap policies cover a basic set of benefits. Here is the chart showing each plan letter design and the benefits covered. The state of Alaska Division of Insurance publishes a Medigap supplement rate guide for Alaska, which is updated each year with tips on how to shop for Medigap plans, the insurance companies approved in Alaska, and which of the plans A through N the insurance companies choose to sell. If you would like a copy of the Alaska Medigap Rate Guide, you can find it online at the State of Alaska Division of Insurance website or by requesting a copy with the Alaska Medicare Information Office. Next slide, please. A Medigap policy only works with original Medicare, Part A and B. If you have other coverage that supplements Medicare, like a retiree coverage, you might not need Medigap. If you don't have other insurance, consider whether you can afford Medicare deductibles and co-payments and weigh this against how much the monthly Medigap premium will cost. Next slide, please. Usually, the best time to buy a Medigap policy is during your Medigap open enrollment period. It begins the first day of the month in which you are 65 or older and enrolled in both Part A and Part B. The Medigap open enrollment period gives you a guaranteed right to buy a Medigap policy, which means the insurance companies can't refuse to sell you any policy they offer or charge you more for a policy than they charge someone with no health problems. After your Medigap open enrollment period ends, the insurance companies get to decide if they want to sell to you or refuse you based on age or health conditions. You can buy a Medigap policy whenever a company agrees to sell you one. However, the insurance company can place restrictions on your policy, like a waiting period for pre-existing health conditions. Now I will hand the presentation back to Dana for Medicare Part C, Part D, and how to combat Medicare fraud.
Great, thanks, Janae. Wonderful information. Daryl, can you please go to the next slide for me? A Medicare Advantage or MA plan is another way that you get your Medicare coverage. Plans, sometimes called Part C or MA plans, are offered by Medicare-approved private companies that must follow the rules set by Medicare. If you join an MA plan, you'll still have Medicare, but you'll get your Part A hospital insurance and Part B medical insurance coverage from the MA plan, not original Medicare. In most cases, you'll need to use health care providers who participate in the plan's network. This is usually set up like an HMO or a PPO, where you have a network of doctors and hospitals which participate in the Medicare Advantage plan's network. Alaska doesn't have any Medicare Advantage plans at this time, but we do get all the national commercials. Most of you have probably seen these commercials. They usually consist with a celebrity saying, if you have Medicare, you may be able to get additional benefits you deserve. These plans can offer additional benefits such as dental, vision, and even gym memberships like the Silver Sneakers Club. Although we get all the national commercials, again, we don't have any of these plans available to the public in Alaska at this time, but this could change in the future. Next slide, please. Medicare Part D is Medicare prescription drug coverage. Part D coverage is provided through Medicare prescription drug plans, or PDPs, Medicare Advantage plans, and some other Medicare health plans. You have to have some part of Medicare A and or Part B in order to have a Part D plan. If you have credible drug coverage means it's as good as Medicare or better, either through a secondary insurance, Indian Health Services, or some other insurance, then you may not need a Part D plan. The Part D plans are overseen by Medicare, but provided by private insurance. In Alaska, we have 25 different plans available. Each plan has their own premium, ranging from $7.30 all the way up to $93.70. The deductible can be up to $445, And if you have a higher income, just like with Part B, you could pay a higher premium, or IRMA. The best way to find the right Part D plan for you is to go online to Medicare.gov, use the Medicare Plan Finder tool to create your drug list, choose the pharmacy of your choice or multiple pharmacies if you want to compare them, and the Medicare Plan Finder tool will organize the 25 different plans by your choosing. If you want the lowest cost plan for the remainder of the year, choose the filter and it'll organize the plans least expensive to most expensive based on the premium, deductible, and what the co-insurance will be with the medications you entered in that list. If you only want to see specific insurance company, or you want to filter the plans by star rating, you can do that too. If you're not internet savvy, or you just want an experienced set of eyes to help you look over the different plans, you can call our office, and we're always happy to help with this. Next slide, please. You can join a Medicare drug plan when you first become eligible for Medicare during your initial enrollment period. So anytime during the 7-month window, as long as you have either Medicare Part A and or Part B. You can reevaluate your plan each year during the annual enrollment period from October 15th to December 7th. Any eligible person can join, switch, or drop a Medicare drug plan at that time. The change will take effect on January 1st, as long as the plan gets your request by December 7th. I strongly encourage everyone to reevaluate your Part D plan each and every year. The plan can change their formulary, meaning which medications they cover and don't, premium cost, deductible, and even co-payment. So it's a good idea to reevaluate your plan, even if you've been happy with them over the past year. Outside of your initial enrollment period and the annual enrollment period, you cannot just change your Part D plan or enroll in a Part D plan unless you qualify for a special enrollment period. The special enrollment periods are specific situations which may allow you to join, switch, or drop Medicare drug plan outside of that annual and initial enrollment period. A few examples are if you permanently move out of your plan service area. So if you move out of the state of Alaska, you can review the plans in your current area. If you lose other credible prescription drug coverage, if you weren't adequately informed that your other coverage wasn't credible, or that the coverage was reduced so that it was no longer credible. When you enter, live at, or leave a long-term care facility like a nursing home, and if you qualify for extra help, or if you no longer qualify for extra help, these could all provide you that special enrollment period. Next slide, please. If you choose not to join a Medicare drug plan at the first opportunity, you may have to pay a late enrollment penalty in addition to your regular monthly premium if you enroll later. If you had other credible drug coverage, or if you qualify for extra help, you won't have to pay for that late enrollment penalty. Medicare calculates the late enrollment penalty by multiplying 1% times the number of full uncovered months that you didn't have a Part D plan once you were eligible, or any other credible drug coverage, times the current national base beneficiary premium. For 2021, that's $33.06. The final amount is then rounded to the nearest 10 cents and added to your plan's monthly premium. The national base beneficiary premium changes each and every year, so that penalty amount may also change when it's determined. You may have to pay a penalty for as long as you have the Medicare drug plan. Your Medicare plan is required to tell you if you owe a penalty and what your payment will be. The late enrollment penalty goes to the Medicare Trust Fund, not the plan. If you don't agree with your late enrollment penalty, you may be able to ask Medicare for a review or reconsideration. You'll need to fill out the reconsideration request form that your plan will send you, and you'll have the chance to provide proof that supports your case. Next slide, please. There are programs available to help people with limited income and resources pay their health care and/or prescription drug costs. These include the Medicare Savings Program, Extra Help, and Medicaid. If you have limited income and resources, applying for one or all of these programs may provide help with your Medicare costs. The Extra Help program helps people with limited income and resources with their Part D prescription drug costs. You can apply by filling out the paper application, or you can go online and apply at the Social Security website, or you can contact our office and we can help you do that application over the telephone. The Medicare Savings Program provides help from the state paying for Medicare costs, including Medicare premium, deductible, coinsurance, and copayment. This program is also known as QIMBY or QMB, SLIMB or SLMB, or buy-in. It often has a higher income and resource guideline than full Medicaid. Medicaid helps pay Medicare costs for some people with limited income and resources. It is jointly funded by the federal and state government and is administered by the state of Alaska. The Division of Public Assistance handles the application for Medicaid and the Medicare Savings Program and determines an individual's eligibility. For more information on income and resource limits, please visit our website at www.medicare.alaska.gov. And we have a nice one-page flyer that you can see these income and asset guidelines. Next slide, please. I want to take a few minutes today and talk about healthcare fraud, waste, errors, and abuse, how they affect you, and how you can take charge to prevent fraud and abuse in 3 easy steps: protect, detect, and report. The Senior Medicare Patrol, also known as the Medicare Information Office in Alaska, is here to help you avoid these problems. Senior Medicare Patrol Program, or SMPs, help Medicare and Medicaid beneficiaries prevent, detect, and report healthcare fraud, errors, and abuse. By doing so, we help preserve the integrity of the Medicare and Medicaid program. Because this work often requires extensive contact to be most effective, SMPs nationwide rely on approximately 5,000 volunteers who are active each year to help in these efforts. Next slide, please. You might be wondering why I should care about Medicare fraud. Well, Medicare fraud, errors, and abuse affect everyone. Each year, Medicare loses billions of taxpayer dollars to improper claims. This puts the Medicare Trust Fund at risk for everyone and affects the future of the Medicare program. Medicare fraud, errors, and abuse also affect current Medicare beneficiaries because they result in higher Medicare premiums and waste money that could be used to increase and improve healthcare services. Medicare fraud, errors, and abuse can also cause serious personal consequences for beneficiaries, such as medical identity theft, negative health impacts, and personal financial losses. Medical identity theft occurs when a beneficiary's Medicare number is misused, either by a provider, a supplier, or by someone posing as the real beneficiary in order to receive medical care. Such Medicare numbers are considered compromised. Now that we have the new Medicare number, if someone finds their Medicare number has been compromised, they can be issued a new Medicare number upon request. Receiving health care from a fraudulent provider can mean the quality of care is poor. The intervention is not medically necessary, or worse, the intervention is actually harmful. A beneficiary may later receive improper medical treatments from legitimate providers as a result of inaccurate medical records. Additionally, because of inaccurate or fraudulent claims to Medicare, beneficiaries may be denied needed Medicare benefits. Also, there may be legal consequences for beneficiaries who are complicit in fraud and abuse, since participating in schemes to defraud Medicare is illegal. Next slide, please. Just so we're all on the same page, let me explain what I mean when I use the term Medicare fraud and abuse. Medicare fraud involves intentionally billing Medicare for services that were not received. We're billing for services at a higher rate than is actually justified. Medicare abuse occurs when providers supply services or products that are not medically necessary or that do not meet the professional standards. Medicare fraud and abuse are very similar and many times overlap. Next slide, please. Here are some examples of fraud and abuse. Billing for services, supplies, or equipment that were not provided. Billing for excessive medical supplies. Obtaining or giving Medicare number for free services. Treat any offer for free services in exchange for your Medicare or healthcare identification number with caution. Improper coding to obtain higher payment. Unneeded or excessive x-rays or lab tests. Claims for services that are not medically necessary. Using another person's Medicare number or letting someone else use your number to obtain medical care, supplies, or equipment. Next slide, please. Scams are another big part of Medicare fraud and abuse. The coronavirus pandemic has opened the door for a lot of scams. Scammers are quick to jump on any changes with Medicare and use the information to try and get personal information from folks for their own gain. Make sure you protect your Medicare number and only provide it to trusted individuals who have a need to know. Trusted individuals can be your doctors, pharmacists, other health care providers, your insurer, or people you trust to work with Medicare on your behalf. Scammers will call and they'll use scare tactics. Don't fall for it. Medicare is not just going to call you out of the blue. If you didn't call Medicare first and request a callback, chances are it's not really Medicare calling you. Most correspondence will be sent by mail. Next slide, please. The newest scam we are seeing nationwide is the vaccine survey. We have received reports of the new COVID-19 vaccine email scam, where people are asked to complete a survey. They offer a free reward, but ask people to pay a nominal fee to cover the shipping. Survey scams like this are a creative way to steal your identity or money. Many survey scams offer a reward and give you a limited time to respond if you want to take the survey. A legitimate survey would not assign a time limit, nor would they ask for your credit card or bank account to pay for the reward. Scammers know people have received vaccines and they're capitalizing on it. Don't give out sensitive information. Fake surveys can be used for a myriad of uses: to steal your information, collect data about you to commit identity theft, or even install malware on your computer when you click on the link in your email. CMS, the CDC, and the vaccine companies, Pfizer, Moderna, and Johnson & Johnson, are currently directing all vaccine recipients to enroll in the CDC V-Safe program as the post-vaccine monitoring mechanism. There is no other survey being recommended at this time. Please contact the Medicare Information Office, your local SMP, at 1-800-478-6065 if you have responded to this or received a similar survey email. Next slide, please. So what can you do to take charge and help prevent Medicare fraud, errors, and abuse? I'm here to tell you how in 3 easy steps. Protect, detect, and report. First, protect yourself and your loved ones from Medicare fraud and abuse. Do treat your Medicare and Social Security card numbers like a credit card. Don't give out your Medicare number except to a trusted individual with a need to know, like your doctor, hospital, or other Medicare provider. Do watch out for identity theft. Scam artists will not only use your Medicare number to defraud the Medicare system. If you find your Medicare number has been compromised, notify Medicare and request a new number. Do be aware that Medicare doesn't call or visit to sell you anything. However, Medicare does now require their contractors to contact beneficiaries from time to time. So make sure to be vigilant. Keep in mind that you don't have to talk to anyone who calls you or shows up at your door who you do not trust. Medicare contractors will understand. Do be cautious of offers for free medical services. If it sounds too good to be true, it probably is. Do pass it on. Share this information with friends, family members who might not already know how to prevent Medicare fraud and abuse. Next slide, please. Second, detect Medicare fraud and abuse. Even when you do everything right, there's a chance that you could be a target of healthcare fraud. There are many ways that a personal information can be used without our permission. Record doctor visits, tests, and procedures in a personal healthcare journal or calendar. Always review your Medicare summary notice and explanation of benefits for mistakes. Look for 3 things on your billing statement: charges for something you didn't receive, billing for the same thing twice, and services that are not ordered by your doctor. Compare your Medicare summary notice and other statements to your personal health care journal or prescription drug receipts to make sure that they are correct. And of course, you can always access your My Medicare account 24 hours a day at medicare.gov. Next slide, please. Third, if you detect or suspect fraud or abuse, report it. You will protect others from becoming victims and to help save your Medicare benefits. To report your concerns, first, if you have a question about the information on your Medicare summary notice or explanation of benefits, call your provider or plan to find out if it was an error that can be corrected without taking further action. If you're not satisfied with the response that you get, or maybe you're not comfortable calling your provider or plan, gather all the facts that you can about the situation. Make sure you have that Medicare summary notice or explanation of benefits and any other supporting documents that show the possible fraud or abuse. Then contact your SMP if you need help. Please keep in mind that services provided by your SMP are free and confidential. Remember how you can take charge and help prevent Medicare fraud, errors, and abuse in those 3 easy steps: protect, detect, and report. And remember to take what you know and pass it on to friends and loved ones who might not be familiar with this information. Next slide, please. If you're interested in attending other events we offer, please go to our website at www.medicare.alaska.gov and click the calendar of events. This will show you all the outreach events we have scheduled, and this does change all the time. Thank you for taking the time to come and learn about Medicare. And I just want to say thank you, Daryl, for giving us this opportunity to get this information out there. We can go ahead and open it up for questions.
Thanks so much, Dana. As always, you guys deliver fantastic content. We always appreciate it. And I've been through many, many Medicare trainings, and I always learn something. So thanks you guys for another great presentation. I would like to open it up now. If you have questions, feel free to raise your hand or your virtual hand, raise your real voice. Let us know if you have any questions. Now is a great opportunity. You've got some people on this call today with some great information that can really be helpful. And so if you have some questions, feel free to let us know right now. I'm going to just check through all the folks. I don't see any hands raised right now, but I want to give everybody another minute or two as we try to navigate the Zoom tools to make sure everyone has an opportunity to ask a question if they'd like to. So we'll go ahead and give everybody another minute. And would like to give a shout out to Mr. D. Dill. I see him on the video today, so good to see you, Dill. Great counselor, Mr. D, and great to have you with us. Hopefully we'll see you out on the road here soon, D. Look forward to getting back out there again with you. Again, any folks have any questions? Here's a great opportunity to ask some questions, and if not, I don't see any other questions or any hands raised. You guys, as always, have done a fantastic job. And I know that's a lot of content for people to consume in an hour. But I also want to make sure that people know if they wake up at 2 o'clock in the morning and have a question and they want to connect with you the next day, there's some good ways to get a hold of you guys there and ask those questions. Please don't call the Medicare folks at 2 in the morning. I don't think they're awake or probably at their desks. But there's the contact information on the screen. So I do want to say thank you to Dana, Janae, Heather, Colton for joining us today. Dee, of course, you're a fantastic volunteer. I want to make sure to give you a shout out too. Great to see you on the call. And any final words from anyone with the Medicare Information Office this morning or this afternoon?
I just like to share one thing. We do have our shared email address up on this slide. That's the hss.medicare@alaska.gov. Please feel free to send an email if you have questions, but don't send any personal or protected health information. So don't provide us your social in there. If you have general questions, you would send it to that email address, or if you wanted to ask for maybe an appointment with one of us, you could send it in that email address, and we're happy to answer. All 4 of us work out of that email address, so you will get a response from one of the 4 of us. But please just don't put any information that somebody else could get their hands on, because it's not protected email.
Great, thanks so much.
Otherwise, thank you for having us, Daryl.
Yeah, thanks so much.
Sorry, this is Heather. I just wanted to say that if you do call at 2 o'clock in the morning, please leave me a voicemail, because I do get started in the morning and put you guys immediately in the queue. So at 2 o'clock, if you're losing sleep, give me a call and leave me a message and I'll get you a call back.
All right. Well, hopefully the information that was provided today will help people from losing sleep. But we do know that Medicare can cause you to have future questions either the next day or the next month or even the next year. So we are very, very thankful to have this partnership with the Alaska Medicare Information Office. We know that there are about 10,000 people a day across the country turning 65, and that there was a great demand for this information out there. So we will continue to offer these programs.
I didn't watch it last night because they had a second episode of.
Uh-oh. There was a little bit of a, looks like someone was going to talk about their favorite television program. Not sure what that might have been, but who knows? So anyway, but we will continue to offer these programs and hopefully be able to get back out and get these programs available in local communities. And until that time does come, we'll continue to offer them virtually as well. So with that, I do not see any virtual hands or actual physical hands being raised. So I'm going to wish everyone a great afternoon. And again, if you have any questions, feel free to reach out to the Medicare Information Office with the contact information you see on the screen. All right, everybody, have a great day. Enjoy spring when it shows up, and we'll see you down the road. Everybody take care.
Thanks, everyone.